Hi, I'm Dr. Niharika Allu, consultant obstetrician and gynecologist at Birthright by Rainbow Hospitals, Visakhapatnam. So today I'm going to talk about uterine fibroids. Most of you would have heard about uterine fibroids. So fibroids are nothing but overgrowth of the uterine tissue. So they can be single fibroids or they can be multiple, many fibroids in the uterus, and because of that the shape, size and the weight of the uterus may vary. So the uterine fibroids can be inside the uterine cavity, in the wall of the uterus or outside also. So it can be in any position and it can be coexisting. So there can be a fibroid inside and also in the body wall and also outside. So depending on the shape, size and the position of the fibroid, the patient may have different symptoms. So most of the fibroids cause very heavy menstrual bleeding, and they may cause lot of pain during the periods, and they can actually have periods which can be very frequent, like they may have periods every 20 days, every 15 days. So if any of you experience any of these symptoms, you should definitely reach out to your gynecologist, get a scan done and then find out what is the size and position of those fibroids. And it can also be associated with thyroid problems. So you should also get your thyroid and hemoglobin checked, because having heavy menstrual bleeding on a regular basis can also cause less hemoglobin. So when you have fibroids, it is not necessary that you should get a hysterectomy. You should also look at other options which are alternatives to hysterectomy. Like we have medicines to decrease the size of the fibroid, we have oral medications, we have intrauterine device which releases hormones which can also decrease the size of the fibroid and prevent further development of fibroids. We have other procedures which can be done through the uterine cavity inside and remove the fibroids, or we can do minimal access surgery in the form of laparoscopic myomectomy to remove the fibroids. So you can do any of these things if indicated, and only as a last resort you should consider a hysterectomy. Fibroids sometimes can also cause infertility, that is difficulty in conception. So only if fibroid is the only reason for conception not happening, where other factors like having a male factor problem or female having ovulation problems or different problems are ruled out, that is when you should consider a fibroid surgery to help in conception. So we treat fibroids based on the patient profile. It's a very individualized decision, and please do not go by the myth that if you have a fibroid, you should get a hysterectomy. So we treat depending upon what is your age, what are your symptoms, what are your problems, and what is your menopausal status. So depending on all this is how we treat fibroids, because usually fibroids, if left untreated and they are not causing you any symptoms, can actually regress after menopause. So usually fibroids are not very problematic when you are closer to your menopause.